Some Nigerian nurses and midwives have threatened to take legal action against the Nursing and Midwifery Council of Nigeria over the new certificate verification guidelines. The nurses disclosed this in a pre-action notice letter served by their counsel at Delewa, Williams and Partners. The NMCN, in its revised guidelines, stated that the applicants seeking verification of certificates from foreign nursing boards and councils must possess 2 years of post-qualification experience from the date of issuance of the permanent practicing license. Now, in a related issue, the problem of shortage of health professionals in sub-Saharan Africa, including Nigeria, has been further compounded by the medical brain drain, which many have attributed to the failure of health system leadership in the country. Nigeria's healthcare professionals have been mitigating in drones to the United Kingdom, United States, Canada, Australia and other developed nations. For this conversation, I'm now joined by founder and CEO of Nurses on Air, Josiah Jackson-Okesola. He will be talking to us from the UK, as well as nurse researcher Fawole Israel with us in the Lagos studios. Good to have you both on Arise News.
Yeah, thank you so much.
Very good. Now, I'm going to start with you, Josiah, and not too long ago, you and I spoke about this recently, but the situation remains the same. Do you see a way forward, and what will it take? I remember the last conversation we had, you said both the Nursing Council and, of course, the nurses are both right. They have a case here.
Yeah, and why I said that is because the government is pointing to a problem, a brain drain. We see the problem. Healthcare professionals are moving. And Nursing Council is saying they want to protect the lives of Nigerians. Yeah, that's okay, that's fine. But what we are saying is that we're treating the symptoms. We said it. Until we begin to focus on these are not the real issues. It's like putting the cart before the horse. Until we begin to focus on the real issues. And the question is, how did we get here in the first place? The ongoing nursing crisis is just a symptom of a bigger problem. These problems have been there for 20 years. It's not been addressed. Until we go back to the drawing board and begin to address the root causes of these symptoms that we're seeing, we're not serious. We're not serious as a nation. We become serious when we look at where exactly do we start from. And that points us to the fact that there have been policies, there have been efforts, there have been moved before now to prevent this problem. But we don't have a government that is serious about putting health at the forefront. Until we have a government that is committed to putting health at the forefront, we might not actually solve this problem. The crisis will deepen. Now, one of the major areas is the Abuja Declaration. This is a very, very straightforward and simple analysis. In 2001, African member states came together and they all agreed that in order to avert the crisis we have on our hands now, we need to devote at least 15% of the national budget to healthcare. But over the last 20 years, what have we had? We've had wastages. We are a wasteful nation. We mismanage our resources. Money that's supposed to be devoted to healthcare have been spent on frivolous things. We're talking about no health insurance for every average Nigerian. We're talking about the facilities that we have been underfunded. And the biggest of all, the healthcare workers who are supposed to drive healthcare delivery for the average Nigerian are not taken care of. So until we go back and say, what are we can't expect to reap where we're not investing. How much are we investing in the healthcare sector? How much are we investing in healthcare facilities? And more importantly, how much have we invested in the healthcare workforce? Until we begin to close the gaps, the leakages, where we're wasting money on frivolous things, and then bring those money into health, we are still joking.
All right, Josiah, I would like you to hold your thoughts while I, go to Fawole, who's in Lagos here with us. You've heard him and his submissions, as it were. But Let me take the features here. The Nursing Council says applicants seeking verification of certificates from Foreign Nursing Board and Council must possess at least 2 years of post-qualification experience from the date of the issue of the permanent practicing license. So, which means to a large extent, those who are unemployed will feel this pinch the most, because they will need a letter of some kind of good behavior from the employers, well, if they have one, okay, you know, to be able to take to the foreign boards to certify them. So what are your thoughts there?
Okay, so to start with, this policy in itself is entirely flawed. For example, there has been a series of issues that borders around, you know, I don't want to really dwell on the issue of medical imperialism in the healthcare sector, where only doctors become the chief medical director of hospitals. Right. Just last week, a nurse was reporting a case of how the CEO of the hospital here in Lagos asked her, a nurse practitioner, to go and clean the dining where doctors ate in the, you know, in the hospital. And she said, no, that is not my job description. And in recourse to that, you know, she was sent home. She was sacked immediately. Is that somebody you want to go back to the previous employer to go and collect letter of good standing? These issues are really, really enormous, right? Or for example, somebody like Nurse Josiah, who has probably graduated from this institution for about 15, 20 years, you want him to go back to institutions where probably his lecturers are already retired. So new lecturers who are dead, who doesn't even know him, you want them to write letter of good standing for somebody they do not know, they do not teach, they have no interaction with. So it's entirely flawed in its entire sense. So it doesn't make any sense. And I'm also going to emphasize on the fact that I haven't spent 5 years studying nursing in Nigeria, and that is for those who went to public universities. I took character from Jackson-Okesola University of Technology, where I spent 9 years.
9 years?
Yes, secondary to strike actions and other internal, you know, ASU crises and all of those things. So finishing, you do 1 year mandatory internship, 1 year NYC service, you do 2 years mandatory working in a system where nurses are not celebrated, nurses, you know, a very toxic, you know, working environment. For example, somebody like me who wants to, you know, establish as a nurse informatist, who really wants to look at the nexus between technology and healthcare, Nigeria currently does not have that, you know, that facility. We have about 301 career prospects in nursing globally. Currently, nursing Nigeria has about 14. Nigeria does not have that facility to even train me. And I say, oh, okay, so I want to go and study in somewhere like the UK. I don't have the financial resources. But can I go through work route so I'll be able to afford my tuition fee to get trained in that field? And you are putting me through all these constraints. Remember that many of these opportunities also have their age limits in the global north.
True. So
these are serious issues that, you know, the Nursing and Midwifery Council of Nigeria and the government of Nigeria really, really, really needs to, you know, take seriously. And like Nurse Okesola said, he said there are symptoms. There are a lot of issues that really bother, that really battered, you know, reason why nurses are, you know, migrating. We talked about bond scholarship for nurses. How has government actually even supported nurses while they are, you know, in the university while studying? A lot of issues. And we have called on government. We have made several actionable policy recommendations to the government. Provide support for nurses, staff quotas, car loans, wage award, you know, for nurses. For example, I also paid the point of a scenario during Ebola. You know, we only were happened very tragic, where we lost Dr. Stella Adadevo.
Indeed.
Also, yeah, a nurse also died even before Dr. Stella Adadevo. Her name is Jackson-Okesola. Up to today, the government has not even given her any award, no recognition for her. But today there has been a lot of celebrations, you know, about Dr. Stella. I'm not sure. Are you also aware that a nurse died? So these are serious issues. There's no motivation to even, you know, keep young nurses, you know, to want to practice in the. And of course, you know, there's serious workload on, you know, nursing practitioners. I also raised an issue about the interview that the registrar had on a TV station some time ago, saying that average Nigerian nurse earn 135,000 naira. That is an absolute lie. I mean, you should come out with this data. Even as a nurse, when I was working as an intern nurse in your state, I think I was on grade level 8. I was earning, my take home was 96,000 naira. After laborious work of 30 days, 96,000 naira. That is on grade. That is because I am a graduate nurse. not for those who went to colleges of nursing and all of those. So these are serious issues. And of course, if you are saying, oh, don't want people to travel, and you are trying to make, create very serious, what do you call it, red tape bureaucracies to allow them to travel, then what are you putting in place, to meditate, to really soften a lot of things that actually make, nurses to consider going to, to other places around the world to travel? There's nothing in place.
Very good, Fawole. I'll come back to you. Josiah is still in the UK with us. So the nurses are threatening to take legal action over the new certificate verification guidelines. Do you see this conflict, dragging on more than it should, you think?
Yeah, it will drag on as long as the government, the Federal Ministry of Health, even the legislative house, House of Assembly, as long as they are not focusing on the real problems and treating the symptoms, it will continue. So if this must stop, if this kind of litigations, we're talking about litigations, there are protests on the street. Nurses have not gone to the street to protest in 20 years. It's not happened. Now, nurses are going to the street to protest. These are people that are supposed to be in the hospital taking care of people. They are hungry, they are angry, they are frustrated. So it's not only about litigations, protests. These are just is the tip of the iceberg. The other time I said we're sitting on a keg of gunpowder. If we must prevent this situation from blowing up in our faces, the government need to take urgent action, serious action. I think the problem is that we are placing our focuses in the wrong place. We keep blaming healthcare professionals for wanting to travel, healthcare professionals for wanting to leave the country. We're looking at the pull factors. What are the push factors? So let's just stop talking about brain drain in the term of seeing brain drain as a negative thing. We should begin to ask, what is the government doing to attract its best talents? That should be the focus of our conversation. What is the government doing to retain its best talents? So we should stop saying people have been migrating since the 1960s, 1970s. Healthcare professionals have been migrating. So the reason why we are now, making a lot of noise is because the rate has increased. So we should be asking, what has the government done to ensure that we retain the best brains that we have? We can't prevent migration. We can't. So the government should focus on what are we doing to retain our best brain? What are we doing to make the healthcare profession attractive? And that boils on basic interventions that even a secondary school student know that at the end of the day, we have a population of over 200 million. We have a population of over 6 million unemployed, unskilled population. So all we need to do, this is very simple. All we need to do is focus on how can we close the human resources for health gap by producing mass production of healthcare professionals. Is something that is a simple solution. If we started 5 years ago, if we started 10 years ago, do you know how many healthcare professionals Nigeria will have now? In fact, we will be exporting our healthcare professionals. We will overproducing and exporting them to countries. We have enough. So it is not too late. We are saying it is not too late to start. Stop forcing healthcare workers from leaving. Stop focusing on the pull factors. Start focusing on the push. What is pushing them away? Start that conversation from there. Forget about whether they are going or not. They will go. If you stop nurses from traveling out today, put a law in place, two things will happen. Those who are practicing will find another way of living the profession or living the country. Those who want to call into the profession will have a second thought, and we begin to look for other alternatives or go to other schools in other countries. So we are looking at the wrong focus. Let's begin to focus on the right. If we don't want this crisis to continue, we change our focus and focus on the push factors. Let the government start attending to them immediately, and then we see whether we will not have a change.
Profound thoughts there, Josiah. I'd like you to hold on, and I'll go back to Fawole. And coming from what Josiah said, the brain drains syndrome in the health sector is not new in Nigeria,
right,
but it seems to have gained traction, currently. So,
right,
from your own submission, what will it take? He has given some, from perspective there,
right,
to stem the tide of this,
Oh, okay, thank you so much. So, like I said, we have some actionable policy recommendations for the government. I would read from my phone.
Let's hear it.
Okay, so one, we have recommended to the government adoption of competitive remuneration and compensation packages for nurses, which should include upward review of retention allowance. There should be something called retention allowance. Yeah, we also talked about the upward review of hazard allowance and payment of hardship allowance that accounts for increased caseloads. And also we talked about working hours and burden of cost of living in Nigeria right now. It is, it has skyrocketed. So we talk about the proper consolidation of health care salary. There's corners, and as is obtainable in federal, as should be obtainable in federal and state institutions across the country. So the government should implement the corners that has been, approved for about 4 or 5 years. Till now, it has not been implemented. So that is one of the ways we can retain, nurses and healthcare practitioners in Nigeria. Moving forward, investment in modern tools and technology that support nursing roles and improve the unit efficiency of nurses. Example include, EHR, and that's electronic health record, electronic medical record, health informatics, using of medical informatics, relevant technology tools that will really help nurses practice better, rather than from us being, the digital, the analog kind of nurse. Let us become digital. Let us digitalize the system. It makes the work very easy. Yeah, moving forward, we also talked about domestication of proper placement of graduate nurses to grade level 10 and adjustment of placement of intern nurses to grade level 9. I talked about that earlier as well. Also, we talked about adoption of a liberal and more flexible rostering system that accounts for the convenience of safety of nursing staff and reduce the amount of time and energy spent commuting to work. We recommend migrating nurses from shift duty to core duty to accommodate and account for increased work time. We also talked about, we recommended that increase in the retirement age of nurses from 60 to 65 and 30 to 40 years of service to retain service for a longer period. All these other nurses, they have that experience.
That experience, but what has been the responses to what you've just enumerated?
No responses. We have about, like I said, we have about 16 strong actionable recommendations. If I'm allowed to read them finish, even you objectively sitting at the head of the table, you will see that this addresses the push factor that Jackson-Okesola has been talking about. If I have the time, I would read like 5 more if I have that opportunity. Oh, okay, thank you so much.
All right, I'm sorry, we'll run out of time, but one final take, what will it take the government to commit in 30 seconds?
What?
Will it take the government to commit to your cause?
Nothing. Absolutely not. It's just prioritization and taking, these professionals very seriously.
All right, very good, Fawole. Now, Josiah, we've seen strikes by nurses and doctors in the UK agitating for better wages and remuneration, but Nigerian health workers are still flocking there in droves. I'd like your take on this scenario.
Okay, so that brings us to the pull factors now. You understand that the reason why nurses are traveling is not only because of the money. Money is part of it, but that's not in its entirety. We're talking about access to the best of facilities. So if you look at developed countries like UK, they are not talking about abandonment of the welfare of health workers for a long period. They are saying improve what has been done. There is a standard already on ground. They're just agitating for it to be improved because the global economic situation warrants that. The economic situation of UK warrants that. The inflation rate warrants that. But that is completely different from our country. We are saying, let's take student nurses, for example. Let's even start from the young nurses that will become, that we are asking, that we want to retain and force to stay. If in the UK, let me give you an example. What the UK government did is say, if you can become a nurse, we give you £5,000. That is massive. If only Nigerian government can start and say, all young nurses in 200 level, in 300 level, We have sat down with the UK government. We have signed a bilateral agreement. At 200 level, you will go to UK, to the NHS, to have an overseas exchange program, and then you come back, see how the NHS, these are official leaders that you should be investing in. These are not monetary in nature. We're not talking about salary here. We're talking about investment in their intellectual ability. These are people that will return, that will even travel out and return to become the president, the minister of air tomorrow. So we are not looking at the monetary aspect to say there are other factors like investing in their career progression, where other factors like providing the facilities for them to work. I gave an example the other time.
Yeah.
It's worse now. I was in government hospital, public government hospital. The ward I was working on does not have a blood pressure apparatus. I bought in. This is not hearsay. It's
very good, very good. Investing in its its healthcare workers is key.
Invest in the healthcare professionals.
Very good.
Give them the tools. Make them feel proud.
Very good.
Unfortunately, want to stay and practice.
Very good. Unfortunately, that's as much as we can take. Josiah Jackson-Okesola, global nurse advocate in the UK, and of course, Fawole Israel, nursing professional here in Nigeria. I would like to thank you both for your thoughts on this lingering issues. Good to have you with us.